Hi everyone, this is Ms. Romani, and during this lesson we will start our unit on medical technologies by exploring a few medical devices. So let's start by defining what medical technologies are. Simply put, a medical technology is any type of technology that helps us maintain or improve our health. When we think of medical technologies, we might picture huge, complicated, or expensive medical devices. But in reality, medical technologies are all around us and include simple technologies like a thermometer that you might have currently in your home. They, of course, also include complex and expensive technologies like an MRI machine. And as we will explore a little bit in this lesson, they can include new and emerging technologies like robotic limbs. Essentially, medical technologies is a broad term that includes all technology that can be used to diagnose, treat, or cure medical conditions. It would be impossible to talk about all the different medical technologies available in a single lesson. Even over the course of this unit, we will focus on only just a few examples. For this lesson, let's discuss a few medical devices. And let's start with prosthetic devices. Chances are you know of someone who has a prosthetic device, even if you don't think they do. A prosthetic device or prosthesis, very generally, is any device that helps replace, correct, or support a body part. In other words, it replaces a part of the body. It corrects a physical deformity or physiological malfunction of some sort, or it supports a weak or deformed part of the body. Diseased or missing teeth, eyes, limbs, or joints are commonly replaced by prosthetic devices. There's a good chance you know someone who has prosthetic teeth or dental implants. Or you may actually know someone who wears dentures, perhaps a grandparent. Besides dentures and dental prostheses, the most well-known examples of prosthetic devices include artificial body parts, which replace a limb or ones that replace missing eyes. Limb replacement prostheses can be life-changing and help people increase their movement and mobility. People may be missing limbs for a variety of reasons. Reasons like birth defects, accidents, or surgical amputations because of diseases. Terry Fox, one of the most well-known Canadians, was only 18 years old when he was diagnosed with osteogenic sarcoma, a type of bone cancer, and forced to have his right leg amputated 15 centimeters above the knee. Despite losing his leg, Terry Fox decided to run across Canada in order to raise money for cancer research. Unfortunately, 143 days and 5,373 kilometers in, he had to stop running because the cancer had spread to his lungs. Terry Fox performed this incredible feat using a prosthesis designed primarily for walking. Terry Fox died in 1981 at just 22 years old. His accomplishment inspired Canadians across the country, as well as amputees and para-athletes around the world. It also motivated researchers to develop prostheses better suited for running. Earlier prostheses were often made of heavy materials like wood or metals, and allowed for very limited movement. The earliest example of a prosthesis ever discovered is not a leg or an arm, it's actually a toe. A big toe made out of wood that was worn by an Egyptian noblewoman 3,000 years ago. In the 16th century, a French doctor named Ambroise Paré developed the first hinged prosthetic hand and leg with a lock-in knee and elbow joint. This allowed for greater mobility as it allowed the wearer to bend the knee or elbow. And up until modern times, improvements in prosthetics, like better and lighter materials, better fitting prostheses, and prostheses that allowed for greater mobility, have arisen steadily but slowly. However, in the last few decades, advances in robotics technology have allowed for prostheses that can move in response to nerve impulses, much like a natural limb. Not only that, but some recent advancements allow the wearer to not just control the device with their brain, but also to feel sensations like heat and pressure with the device. Advances in 3D printing technology has made it possible for custom-made prostheses to be available to people much easier and at a much lower cost. This is especially important for children who outgrow their prosthetic devices as they age. Developments in material manufacturing, and especially computer and bionic technology, have led to more comfortable, stable, and responsive prostheses. We have come a long way since 1980, when Terry Fox ran his Marathon of Hope, Another common prosthetic device replaces not a full limb, but just the joint. Replacement arthroplasty, or joint replacement surgery, is a procedure of orthopedic surgery in which an arthritic, damaged, or dysfunctional joint is replaced with an orthopedic prosthesis. Joint replacement surgery can be used to replace many joints, like knees, wrists, hips, or elbows. About 130,000 Canadians have a joint replaced every year, with knees and hips being the joints that are replaced most often. So let's take a look at what is involved in these surgeries, starting with hip replacement surgery. Your hip consists of two main parts that fit like a ball and socket: the femoral head at the top of the leg and the acetabulum at the pelvis. A total hip replacement is done when severe damage from arthritis or injury has made it difficult to perform daily activities. An artificial hip prosthesis consists of a cup called the acetabular component and a metal stem called the femoral component. A series of incisions are made until the joint is exposed. Then the hip joint is dislocated by detaching the femoral head from the acetabulum. Next, damage is removed from the acetabulum socket, and the socket is reshaped in order to fit the acetabular component of the prosthesis in place. This is usually done with cement or screws. Next, the femoral head is removed, and the femur is shaped to fit the prosthetic stem, which again is secured in place with cement or screws. Once both components are firmly in place, the prosthetic head is inserted into the acetabular counterpart. The joint is checked for movement, the muscles are repaired, and the wound is closed with stitches or staples. Now let's take a look at what is involved in knee replacement surgery. The knee joint is made up of the lower end of the femur, which moves on the upper end of the tibia as well as the patella. During total knee replacement surgery, the knee joint is exposed and damaged bone ends are removed using special instruments and replaced with components designed to recreate the natural contours of the bones in a healthy knee. The metal and plastic implants allow the bones of the knee to smoothly glide against each other like natural cartilage. Now let's take a look at a different type of medical device, one that helps restore hearing. A cochlear implant is a small electronic device that electrically stimulates the cochlear nerve. The cochlear nerve is the nerve for hearing, which sends sound information to the brain to produce a hearing sensation. Although normal hearing is not fully restored, with appropriate therapy and practice, a cochlear implant may help someone with hearing loss restore or improve the ability to hear and understand speech. The implant has external and internal parts. During normal hearing, the outer ear collects sound waves, which vibrate the eardrum and middle ear, and these vibrations continue into the inner ear, where they stimulate fluid and tiny hairs, which then send electrical signals to our brain through the auditory nerve. It is damage to those tiny hairs that can create hearing loss. A cochlear implant is a good solution because it bypasses the damage and sends auditory signals directly as electrical signals into the auditory nerve. A cochlear implant system consists of an audio processor worn behind the ear and an implant surgically fixed under the skin that permits the insertion of an electrode array into the cochlea. The sounds are captured by the processor's microphone, and they are digitized and processed by the processor. The information coded by the processor is sent to the implant with the antenna. The implant converts information into electric signals and delivers electrical impulses to the auditory nerve as the ciliated cells should do. During the surgery, an incision is made to expose the mastoid bone behind the ear. The bone is removed to where it connects to the middle ear. A channel is drilled into the bone where the implant will sit. Then an electrode array is threaded into the structure of the ear called the cochlea. The incision is then closed. After the incision has healed, the external components of the cochlear implant can be worn and the process is complete. Next, let's explore dialysis treatment, a widely used medical technology that helps people whose kidneys have failed. Did you know that we pee thanks to our kidneys? Our kidneys are our body's filter. They filter our blood every second of every day, removing waste and excess fluids from our body. This waste is then sent to our bladder, and once our bladder is full, we eliminate that waste when we urinate. In other words, we pee out the excess fluid and waste from our blood. Most of us have two kidneys that perform this very important job. But what happens when our kidneys stop working? If you have kidney disease, your kidneys gradually lose function. This can lead to an accumulation of harmful waste, electrolytes, and excess fluid in the body. Increased blood pressure and other health problems, like for example bone and blood problems, can also occur. If the kidneys fail, dialysis treatment can be used to perform the function of the kidneys. Most dialysis treatment is used to treat people with acute kidney failure. According to the National Kidney Foundation, end-stage kidney failure happens when the kidneys are performing at only 10 to 15% of normal function. Since dialysis is a treatment that purifies the blood using a machine, dialysis treatment can also be used to remove drugs or poisons from the blood in the case of an accidental poisoning. In one type of dialysis called hemodialysis, a machine called a dialyzer is used as an artificial kidney to filter and clean the blood outside the patient's body. Some weeks or months before starting hemodialysis, the patient's doctor will create a vascular access site in the patient's body. A vascular access site is a surgically created access site used to remove and return blood during hemodialysis. This access site makes it easier to connect to the blood supply and provides good blood flow during dialysis treatment. The vascular access site could be an arteriovenous or AV fistula, an access created by joining an artery and a vein, typically in the arm, an arteriovenous or AV graft, an access created when doctors put in a tube that connects an artery and a vein, or less frequently, a central line catheter, an access created by inserting a tube into a vein. The tube is inserted through the skin into a vein in the neck, chest, or groin, and the tip of the tube ends near the heart. This access type has the highest risk of infection and are mostly used for short-term use, but they can be placed quickly in an emergency situation. Once the vascular access site has healed, a patient can start hemodialysis. To begin, the nurse will insert 2 needles into the vascular access site. This connects the patient's blood supply to the dialysis machine. The blood flows slowly out of the patient's body and into the dialysis machine. Inside the dialyzer, the blood encounters a number of tubes with a semi-permeable lining and a cleaning dialysing solution called dialysate. This fluid has the same osmotic pressure as blood. The fibers and fluid remove waste, extra ions, and fluid from the blood. The clean blood then returns to the patient's body through the tubing. Another type of dialysis treatment is called peritoneal dialysis. In this type of dialysis, the peritoneum, which are membranes lining the abdomen, are used to clean the blood without removing it from the body. Before this type of dialysis, a surgical procedure will be used to implant a soft catheter into the abdomen, near the belly button. This will create a port through which the dialysate will enter and leave the abdomen. Each peritoneal dialysis session is called an exchange. First, the catheter is used to fill the abdomen with dialysate. Through the peritoneal membrane, waste products and excess fluids are continuously drawn out of the blood into the dialysate. The waste-filled dialysate will then drain out of the abdomen port into a collection bag. Several exchanges will be needed to complete one dialysis session. A final medical device I would like to explore are insulin pumps, in particular the way technology is innovating diabetes management. Type 1 diabetes is a chronic condition in which the pancreas produces little or no insulin. Insulin, as we learned in an earlier unit, is a hormone needed to allow sugar, or glucose, to enter the cells to produce energy. Since people with type 1 diabetes no longer produce insulin, the glucose they consume cannot enter the body cells and build up in the blood. This results in an abnormally high blood glucose level, a condition called hyperglycemia. The symptoms of hyperglycemia include thirst, frequent urination, and fatigue. Over the long term, it can cause damage to the eyes, kidneys, nerves, blood vessels, and heart. In order to avoid hyperglycemia, people with type 1 diabetes must inject with insulin every day. Injected insulin allows glucose to enter the body cells to be used for energy. Sometimes, if there's an imbalance between injected insulin and the glucose in the bloodstream, blood sugar levels may fall too low, a condition called hypoglycemia. Symptoms of hypoglycemia include trembling, palpitations, and sweating. Despite active research, type 1 diabetes still has no cure. Treatment typically focuses on balancing blood sugar by constantly monitoring blood sugar levels, usually by pricking your finger into a blood glucose meter. Also, keeping a close eye on sugar consumption and introducing insulin into the body by injections a few times a day, depending on the amount of sugar that was consumed and the amount of glucose in the blood. Failing to maintain a proper balance can lead to hypoglycemia or hyperglycemia. Sounds complicated and tedious? Well, it is. However, this is where insulin pumps can help. An insulin pump is a small device that mimics some of the ways the pancreas works. It delivers continuous and customized doses of rapid-acting insulin 24 hours a day to match the body's needs. With insulin pumps, there is no need for injections. Insulin pumps are not new technology. They've been around since the 1970s, although the first pump was so large that it was worn as a backpack. Since that time, insulin pumps have gotten smaller. Today, insulin pumps are so small that they can fit in a pocket or a purse. Traditional tube insulin pumps deliver insulin via a long plastic tubing connected to the body via an infusion set. The insulin pump can typically hold up to 3 days of insulin. Newer, closed-loop systems, commonly referred to as artificial pancreas, combine a continuous glucose monitor and an insulin pump to regulate a user's insulin with minimal interaction from the patient. They work like this. A continuous glucose monitor sends blood sugar data to the pump. The pump uses an algorithm to target a specific blood sugar range and delivers enough insulin into the body to keep the patient on target. The system is still not fully autonomous, since the patient has to tell the device how many grams of sugar they consume for the system to work. Patch pumps and other progressive methods of drug delivery are making insulin delivery even more convenient for diabetics. Patch pumps adhere to the skin without the need for plastic tubing like traditional pumps. They are fully disposable and waterproof, lasting 72 hours on the body and holding up to 200 units of insulin, and use smartphone-like devices as the controller. There are a lot of new systems in the works. Pumps that are smaller, patch pumps that use a closed-loop system, and ones that can be controlled by the user's own phone. So digital and robotics technology is helping to transform the healthcare system. Advances in medical technologies could mean cheaper, faster, and more effective solutions for diseases that will make all of our lives easier and better. During the course of this unit, we will explore a selection of medical technologies that are used to diagnose, treat, and cure medical conditions. Talk to you soon.